Hi, everyone. It's me, Fran Drescher, and welcome once again to Coroa Care for You, hosted by Cancer Schmancer. And it's our new series during this time, offering you expert opinions and advice from some of our medical advisory members, one of which is here with us today, the esteemed Dr. Dale Bredesen. Welcome, Dr. Bredesen. How are you?
Thanks very much, and thanks, Fran, for everything you and your team are doing. It's fantastic.
Oh, well, you know, we believe in you and your colleagues and all the work that you're doing and connecting the whole body as a system and not just looking at the end symptom of a problem, but really investigating the full scope of what's impacting us as a species and compromising our health on a escalating level, it feels like. So your expertise, of course, is with Alzheimer's, and that is something that is of big concern to many of our members. Some have been personally affected, and others are just in fear that, the day may come when they don't recognize themselves. Right. So let's talk about that, and perhaps you can also connect some dots with us as to how, what are the theories behind viruses and how they also impact the brain and could be a contributor to why we're seeing this escalation in Alzheimer's and dementia.
You're absolutely right. There's a tremendous increase. As you know, in Alzheimer's, it's now become the third leading cause of death in the United States. And you've been teaching people for years. Yeah, it's really a problem. And
what actually kills you?
Yeah, it's actually the very, very end, after you become very debilitated, actually turns out to be typically pneumonia or bladder infections or a pulmonary embolus from not walking around. So it's typically infection or clots and things like that, but it brings you there. But you've been talking for years about improved resilience and improved health, and we've been talking about the same, what you've been talking about for cancer, we've been talking about for Alzheimer's. What COVID-19 has done, it's taken this where we're concerned about 20 years, 30 years, 40 years for problems with the brain, and it has compressed it into a few weeks. And if you look at the mortality from COVID-19, 86% of the people who pass away have these other problems. They have hypertension, they have type 2 diabetes, they have leaky gut, they have heart disease. So all the things that you've been teaching about to stay away from cancer, to have a much healthier life, and we've been looking at with Alzheimer's, are unfortunately coming to roost and being pushed, squeezed into this short time because of COVID-19.
That's so interesting. And, I'm glad that you connected those dots between the people that are being hit the hardest with this virus and the fact that they themselves are unhealthy to begin with.
Exactly.
What is the correlation between, and you had mentioned leaky gut, between gut and brain function?
This is a huge correlation, actually, and one of the most common things we see. And by the way, we've just been reported 4 more wonderful turnarounds in people with Alzheimer's, so we're very enthusiastic. And we're in the middle of the first trial in history in which you actually ask what's causing the cognitive decline instead of predetermining how to treat it. So what happens is there are several things that you can literally follow the molecules into the brain and see how you change from making synapses, making memories, keeping memories, to now downsizing. Literally, Alzheimer's is a downsizing of the connections in your brain. And one of the critical pieces that changes that is a molecule called NF-kappa B. And guess what activates that? Any sort of chronic inflammation. So if you have a leaky gut, as so many of us do, this will actually activate that pathway, which then goes into your brain and literally cuts a molecule that gives you the amyloid that we associate with Alzheimer's. So there's a very tight link between any of these chronic inflammatory conditions, just as there is with heart disease.
And what do you attribute this leaky gut to?
Great question. So it is, depending on who we are, it is Poor diet is a very common one. Processed foods, as you know, too much sugar, too much stress, too much alcohol, poor sleep. Any of these things can disrupt. So it's important, again, creating resilience is the key for avoiding cancer, for avoiding Alzheimer's, and of course, for making COVID-19 much harder to get you. So you want to be as resilient as possible, which of course is not easy.
Well, what are the, the most important areas of our life that we need to look at to create a resiliency in our body?
It's a great point. So, it starts out with, as you've often pointed out, it starts out with the food you eat and making it so that it's not full of all sorts of pesticides, and making sure that it's not going to give you chronic toxicity, because that also can damage your gut. It's then exercise, and this is not so easy while we're all sheltering in place. It's critical whether you get some exercise indoors or whether you practice social distancing, but get outside.
The vacuuming, washing floors, and doing laundry count.
The nanny would be very resistant to this problem with all that hard work.
I have done so much housework since I've been alone here. I can't even tell you, Doc.
There you go. You're going to have a clean house and a clean health.
Good.
Bill. So this is great. So that's critical. And then, of course, keeping your stress down. By the way, laughter. And interestingly, one of the things that's been brought up is increasing your nitric oxide. And interestingly, one of the things that does that is humming. So I hope that you're humming to yourself as you do some of this. It actually turns out to be helpful. It helps.
I heard about that too, and I started humming as well. Because and it's such an easy thing. On the exhale, you go, and you find the tone that vibrates your sinuses the most, and that's the good tone. And the reason for that is because of an increase in nitric oxide?
That's right. And so what it does is actually dilates the vessels a little and gives you better blood flow. So,
wow.
So in your resilience, exercise, sleep, stress, and, challenging yourself, things like that. These are all helpful. And then there are some things, of course, we can all take. Of course, we've heard a lot about vitamin D. We've heard a lot about vitamin C. One of the things I happen to like is called AHCC, which is actually a specific extract that actually supports your cellular immune system. So as you know, your immune system, the adaptive part of it is humoral and cellular. So it's the antibodies, and then it's the cells. And the cells are the more important ones for fighting any virus. And therefore, AHCC, which actually supports that part of the immune system, is quite helpful and quite a good thing to do.
So is that a supplement, or what is AHCC?
Yeah, it's called active hexose correlated compound. And it is actually an extract from specific mushrooms. And yes, you can get it as a supplement.
As a tincture, or?
You can get it either way. You can get it as capsules, or you can get it as a tincture, either way. Yeah. And
well, that's interesting, because we've, in one of our other programs, we interviewed a different doctor, and he was talking about, health on a cellular level.
Yeah.
But he hadn't mentioned that, but I think that that's a great tip, and something that I'm going to try and find online.
And good for prevention of viral infections. And of course, things like R-lipoic acid, another good one. And then of course, the most important of all, keeping your distance. People have talked about 6 feet, but that's really not enough. The studies have shown you're talking really more about 15 feet or more. And as you know, the droplets last on surfaces for up to 5 days or so. So you really, unfortunately, you really want to keep your distance and have a nice mask for yourself. And of course, there's some controversy about the function of the masks. Some of these cloth masks, the argument was they may not work as well as you'd hope, but in fact, they do at least do something. And if you've got an N95 mask, that also very, very helpful. So yeah, please, we've got to all stay safe for the next several weeks at least.
And whatever you cover your face up with, at the very least, will remind you not to touch your face.
Exactly. Yeah, when you're out and about, when you come back, make sure to wash your hands, and that's going to really helpful. So again, all of these things that create this resilience, from the things you eat to the exercise you do to the joy you have in your life, will help you both on the Alzheimer's, the cancer side, will also help you on the resistance to COVID side.
Is there any information as to like any kind of bacteria or something that goes up into the brain that promotes Alzheimer's, like Lyme or?
That's a really good point. So, when we think about something like, let's say, tuberculosis, that's one organism. When you have Alzheimer's, you're right, it's very different. That is a response to multiple different things. So it can be a response to recurrent herpes infections of the brain. It can be associated, as you said, with Lyme disease. It can be associated with actually bacteria from your dentition. So keeping good dentition turns out to be really helpful. And some people like to use something called dental Sidon. It's a mouthwash and a toothpaste both, which helps to get rid of these. And you can actually check your oral bacteria. There's a simple test called oral DNA. You can see so there's one called P. gingivalis that actually does get into the brain. Another one called T. denticola, which gets into the brain, and several others. And then there are things that get into your sinuses. And of course, we've heard that COVID can get into the sinuses and actually not only affect your lungs, but can, in some cases, affect your brain, unfortunately. So we really want to keep this area in good shape to avoid both Alzheimer's and problems with viruses. So you're absolutely right, multiple different pathogens.
Wow, wow. So, at the end of the day, we really have to consider a lot of different interferences that could, and connect it to the fact that if you're exposing yourself to any number of interferences, it could ultimately go into your brain and create that problem of Alzheimer's.
Absolutely. And as you indicated earlier, the brain is connected to the rest of your body. So it is connected to your sinuses. It is connected to your mouth. It is connected to your blood. These various organs are talking to each other, and your brain, unfortunately, can suffer when you have exposure to these various things.
So it sounds like, the best kind of advice is to globally have a pristine lifestyle as much as possible. Try and really honor your body constantly with pristine everything. So, you're not setting yourself up for failure.
Exactly right. And, the key here is get checked. So for anyone, as you get to 45 or so, we talk about having a colonoscopy when you're 50. We recommend that anyone over 45 have a cognoscopy, and find out where you stand. Do you have insulin resistance, as about 80 million Americans do? Do you have hypertension? Do you have dyslipidemia? Do you have leaky gut? Do you have chronic inflammation from these various organisms? These are all things that can be addressed, and so it's important to find out if you have them.
What's dyslipidemia?
So yeah, so dyslipidemia. So sorry, that's just if you have a high cholesterol, bad cholesterol, LDL particle number, things like that. And there's also dysbiosis, where you have the wrong microbiome in your gut. So you may have specific fungi growing in your gut that shouldn't be there, for example. And again, once you know about these things, you can deal with them. All of these, as you said, making you resilient, making you globally healthy.
Tell us a little bit about your book in case any of our viewers would like to get a hold of it.
Thanks so much. Yeah, so The End of Alzheimer's came out in 2017. It's now out in 32 languages. I was on New York Times bestseller list for 5 months. So now a lot of people who read it said, great, we'd like a little more detail on where to go, what websites to use, what doctors to see, all this. So that is actually in the next book, which will be out on August 18th of this year.
Oh, congratulations.
So that's the program to go along with the first book. And so
in the first book, you actually had a suggested diet of what to eat and what to avoid that also helps brain health, correct?
Absolutely. Yeah, we call this Keto Flex 12-3 because the idea is driving you into mild ketosis with a plant-rich diet with appropriate fasting. And as you know, fasting has turned out to be very helpful, including for the brain. And all of these things together give you a mildly ketotic state. And what happens is you do have an energy failure in your brain when you have Alzheimer's. So we want to top up that energy. We want to fill it back up again. And it turns out that ketones, very good way, they enter the brain and they in fact provide the energy that is needed. They also, by the way, increase your growth factors. This one that's an important one called BDNF, which is for brain-derived neurotrophic factor, increased by the ketones and really help to make and keep those new connections that are so critical for avoiding Alzheimer's disease.
Could you just very simply explain what ketosis is?
Yeah, that's a great point, Fran. So we have two ways that we can use energy. Our cells need energy, and as you know, and they have these wonderful mitochondria, little batteries in there. And so you have to supply your batteries with something. So you can supply it with carbohydrates, things like sugar, and better yet, of course, if it's complex carbohydrates, which don't give you such a sugar spike, or you can supply them with fats. Now, unfortunately, fats do not get into your brain well in terms of using them for energy. So to get energy for your brain, you can break down your fat, and this actually occurs in your liver. And so this now breaks these down and produces very small molecules that are called ketones. And these are three major ones: acetone, acetoacetate, and the most important one of all, beta hydroxybutyrate, or BHB. And if you measure the ketones in your blood, you're measuring that BHB, which is so important. So this then can carry energy to your brain and can also stimulate your brain. People find that when they're in mild ketosis, they tend to have less brain fog. They tend to think better, and they tend to do much better in terms of Alzheimer's, brain fog, things like that. So that's why it's great to produce these ketones. Now, if you can't make them on your own, because sometimes it takes people a while, you can actually take some ketones. In the long run, you want to be able to make your own, but in the short run, you can take them, and you can take them as ketone salts or ketone esters, or you can take them as MCT oil, for example. Some people like to take some coconut oil, things like that. So all of these can give you those critical ketones that energize your brain.
Well, that's all amazingly helpful information. We have a question from one of our members, so let me just read that, and perhaps you'll be able to answer it for her as well. This is from Stacy. Is there a correlation between brain health and viruses? I've heard that there is some controversy over flu shots and Alzheimer's. So I think we kind of answered the first part of her question, but we haven't gotten into flu vaccines and Alzheimer's as a potential unfortunate side effect.
This is a really good point. In general, as you probably know, flu shots have been associated with a different neurological condition called Guillain-Barré syndrome, where you actually get paralyzed, and then typically it goes away after some period of time, but it can be really tough for weeks. But in general, it's not so much the flu vaccines. It is, as you said, it's the viruses. And for Alzheimer's, the ones that have been identified repeatedly have been the herpes family viruses. So herpes 1, HSV1, HSV2, something called HHV6A, which can get into your brain for many years and give you problems. Epstein-Barr virus, cytomegalovirus, these are all herpes family members. And so one of the studies that was done in Taiwan showed that people who actually treated their outbreaks of herpes had a much lower incidence of going on to develop dementia. So that is actually not a bad thought. Now, as far as the flu vaccine, if you are healthy, then you probably do want to avoid the potential side effects. But as you know, if you're not so healthy, if you're getting elderly, it can be a very protective thing and is unlikely to give you Alzheimer's disease.
It's more likely?
Unlikely. Unlikely.
Unlikely. I see. Okay. Yeah, I haven't ever taken a flu shot. I prefer to come in through the window where I try and really bolster my immune system and not compromise it by surrounding myself with unhealthy things in my home or in my refrigerator. Um, and then I have my homeopathic stuff. If I feel like I'm dipping below the line, I do take a lot of vitamin C and some, homeopathic things that help support the body. I don't know. I think it's a very personal choice to make. And I thought that was an interesting question because most of injections that you get of a vaccine is a dead virus, isn't it?
Yeah, there are two kinds of vaccines. So it can either be a dead virus or it can be a live attenuated virus. So there's, as you probably know, there's been a lot of talk about BCG. BCG is what's used in many countries, but not in the US, to protect against tuberculosis. But there is some suggestion now that it is also giving you some protection against viral infections. So people are looking at it. Could it be the first, because it's available very quickly, vaccine against coronavirus? And so that's still under discussion, and we'll see where that comes out. By the way, people who've had BCG injections are much less likely to develop Alzheimer's disease. So that just came out from a group out of Israel a couple of months ago. Very interesting finding. And they looked at people throughout the world who had had these BCG injections, and they did find that they had a lower incidence of dementia. So you've got to.
So how come it's not available here?
It is available here. It's just that it's not. There's not the usual kind of public health where everybody gets it, because it was a prevention against tuberculosis. Now, I brought it up because it is a live attenuated virus. So it is essentially a much, much weaker version of a cousin of tuberculosis. But it turns out that it stimulates your immune system, and therefore it gives you some protection, potentially against coronavirus. We'll see. All the data aren't in yet. But it also seems to give you some protection against the various things that are giving you increased risk for Alzheimer's disease. So I think there's some interesting and promising data coming up.
Well, I'll tell you, this has been very illuminating. You are absolutely fascinating. We thank you for being on our medical advisory board for Cancer Schmancer and for joining us at the Coroa Care for You series. And I hope everybody out there checks out Dr. Bredesen's book, The End of Alzheimer's. And we look forward to your next book coming out in August of 2020. God knows we need some new and exciting information with everything going on. We're home and we should be reading you. So thank you so much. I wish you and your family good health, and we appreciate you, and we appreciate you taking the time for our series. Hi everyone, it's me, Fran Drescher. Well, I hope you enjoyed Coroa Care for You, and if you did, please think about making a donation to us at cancerschmancer.org/donate. Like so many nonprofits, we've had to cancel all of our fundraising events, so it's really up to you to help keep us going. We depend on your donations, your support, and your love. There is no donation that's too small, and we are grateful to anything that you feel comfortable giving. And continue to come in to the Cancer Schmancer Coroa Care for You series, because we are constantly posting new content, and we hope that it's helpful to you and your family. Don't forget to donate. We really appreciate your support. Thank you.